Hi, welcome back. If this is your first time here, my name is Tracy. I have been specializing in Medicare in the Henderson, Nevada area since 2004. It has become my focus to help you understand this crazy Medicare maze. Strangely, I don't know why, but I like it. This is a follow-up to my getting started video. In that video, I used the analogy of building a house and that Medicare A and B is the foundation to that house. And so this video is going to be the finishing your house and what parts help you do that. And that is going to be your Medicare Advantage and your Medicare Supplements, also known as Medigap plans. And I'm going to help you figure out which way to go for your needs. Be sure to stay to the end because I'm going to give you some important tips on when to enroll, and you don't want to miss that. But let's face it, this is a very dry subject and no one really wants to learn about insurance. I haven't figured out a way to help make it more fun or interesting. So if you can think of some ideas, please post them in the comments section. I'd love to read those and maybe even incorporate them in my next video. So now on to the reason why you're here. You may be wondering, why do I need secondary coverage, right? On your screen, you're going to see a worksheet that I've been using with my clients since 2007, and that seems to help people get the visual of what all the parts are, and then it really helps explain it a little bit better. So at the top of that worksheet, you're going to see some blue images, and those images are going to show you your out-of-pocket expenses to the left, which for your Part A, your hospital skilled nursing facility benefits, and then your Part B, you got your 20%, and you have your deductible, which in 2022 is $233. And your Part B has that 20%, which is an endless potential out of pocket. So unlike your health insurance that you've been used to getting through your employer or say on an individual plan on the marketplace, those have max out-of-pocket limits to them. So for example, if you had a lot of medical expenses that are, racked up throughout the year, the most you would spend is, let's say, $8,550 for that year. And if you reach that, then the insurance company would pick up 100% after that. But under Medicare, basic Medicare at A and B, there's no limit to that 20%. So you could be going on and on and on. Plus, basic Medicare A and B has no prescription drug benefits to it. So you would need to get at least a standalone drug plan through a private insurance company. To be eligible to enroll in a secondary plan, you need to be enrolled in that foundation, the Medicare Part A and B. And if you haven't done that yet, please go back and watch that first getting started video. In that, it's going to help show you how to get that part enrolled. So now, no matter which option you choose, remember, you got to keep that foundation in place. You got to keep paying your Part B premium to Social Security. And in 2022, that is $170.10 per month. So now let's start talking about Medicare Supplements, or also known as Medigap plans first. That's the option 1 you see on your screen. I do recommend people start with this option if it's in your budget. It allows members to see any doctor in the whole United States. As long as that doctor takes Medicare, they will take your supplement. And typically there's a larger number of Medicare providers, basic Medicare providers, than, let's say, for example, in a Medicare Advantage plan, which are typically like your HMOs and your PPOs. So you can go to any provider in the United States. As long as they take Medicare, they will take your supplement. I just feel that's worth repeating. So the plans that are, these plans, the Medicare Supplements, are different than Medicare Advantage plans in that doctors are going to bill your Medicare A and B as primary insurance, and then your secondary is going to be your supplement, and it will kick in and pay after the claim is cleared Medicare. So it's important to note, if a treatment or service is not covered by Medicare, it will also not be covered by your supplement. And the supplements are labeled A through N plans, but for the purpose of simplification, I'm going to focus just on Plan G and Plan N in this video. So Plan G, will start there first, gives you the most coverage available. It covers all of your Part A out-of-pocket expenses, and it covers your 20%. And the only thing you'd be responsible for is the $233 deductible. Once you reach that, after you've gone through your medical care for the year, that's your total medical out-of-pocket expense for that year is $233. So to give you an idea of the cost of Plan G in the Clark County, Nevada area, for a non-smoker male turning 65, as you see on your screen there, Company 1 is $151.52 per month. For a non-smoker female, it's $131.70 per month. And those rates are for also 2022. So they also don't include any potential household discounts or electronic draft discounts. So, for example, it depends on the company that you go with, but you may get, let's say, 12 to 15% extra off of your premium if you're living with somebody over a certain age. In some cases, they don't even have to be enrolled in the same insurance carrier as you. So in a Plan N, you're going to pay lower premium, but you will have more out of pocket when you use the plan. For example, you would have a $20 copay per office visit when you go to the doctor. You would have a $50 per emergency visit fee, and your Part B excess charges would also not be covered. Part B excess charges, just to give you an idea what that might be, doctors are allowed to bill 15% above what Medicare reimburses them. So that's your Part B excess charges. It's rare that that happens, but just know that if you're in a G plan, that would be covered. The other thing you'll notice when I'm talking about a Plan N, for example, is that, yeah, it's $20 to $30 less per month, but think about this scenario. So let's say you're healthy now, so you're thinking, oh man, I would never really need to spend more than I should on premium per month. But let's say you have an accident and you need to go to at least 10 visits to physical therapy, and each time you go, it's a $20 copay. So you could end up spending more in copays than you're saving in your monthly premium by going with a Plan N. Just, little tips, food for thought to think about. You'll notice that I do have the two companies listed on the screen. Well, why we have two different companies? Okay, well, the supplement plans A through N are regulated by the state and Medicare. They're designed to protect you. The differences are the way they do their rating. So it could be community, it could be attained age. It also depends on how much percentage rate increase they do per year. It also depends on, some of them give you value-added benefits that are included as being a member of that plan. So for example, you may get discounts on hearing, gym memberships, vision, what have you. So personally, I chose to represent only A-rated carriers who typically show a consistent lower rate increase over time and have good customer service. And then a lot of times I like the fact that they do offer value-added benefits because it just gives an extra perk for your membership, So I need to mention something that's really important, and you need to think about this when you're enrolling in these plans. As far as the rules go, I found that many of my clients who've been in Medicare for a while were never made aware of these rules. So when you first turn 65, you're eligible to enroll without answering medical questions for the first 6 months. So for example, if your birthday's in June, you get through November to make a change or enroll in a plan without answering any health questions. Or let's say you're over 65 and you chose to wait to enroll because you had employer coverage and now you're ready to retire, so you started your Part B. At that point, you can or must apply for a Medigap policy no later than 63 calendar days after the latest of the 3 following dates. So either 1, the date the coverage ends, or 2, the date on the notice you get from an employer telling you that your coverage has ended, if you get a notice, and or 3, the date on the claim denial, if this is the only way that you get notice that your coverage has ended. So if you choose to enroll past these times, you will have to answer medical questions, and you could be rated higher or declined for coverage based on the answers to those questions. Example, if you choose to start with a Medicare Advantage plan and later decide you want a supplement, then you will have to answer health questions to enroll. This is where I get the question, but didn't the Affordable Care Act make it illegal to ask health questions? Well, yes, it did, but for under 65 health policies. So, your policies that you get through your employer or that you might pick up on the individual marketplace. Those you're not allowed to ask health questions. But Medicare, remember, is a whole different animal. So to mitigate that, they give you that open enrollment time period, or the guarantee issue. It's called a guarantee issue time period as well, where you don't have to answer those medical questions. And then also they have Medicare Advantage options without health questions. So another important point here is if you start with this option and you later decide during open enrollment, which occurs October 15th through December 7th every year, you get the opportunity to switch to a Medicare Advantage plan. Okay, so let's say you do that. Let's say this next open enrollment, you think, oh, you know what? I want to try that Medicare Advantage plan out because I love some of those great extra perks that come on it. Okay, so you make the change, and let's say 3 to 6 months into it, you say, gosh, no, this is not what I expected. I don't want this. You get to switch back with no questions asked. So this is what's called the trial right rule that gives you 12 months to try out the Medicare Advantage side and then switch back with no health questions. And that's perfect, right? Because then you at least know whether you made the right choice or not. And I have to tell you, I have had situations where clients, for whatever reason, don't like making that change. With this option, you do need also, remember, a prescription drug plan, or also it's your Part D coverage. So if you don't take any medications, I've had clients say, well, why do I need a drug plan? I don't take any medications. Well, it's a good idea to enroll in a plan. If you don't choose to enroll in a plan and you don't have any other drug coverage, then you will be assessed a 1% per month penalty. And that's permanent, and it won't go away unless you qualify for what's called low-income subsidy or extra financial help. I typically assist my clients with helping them get a prescription drug plan, and to do that, it's helpful if you give me the list of your medications, and then I plug them into a tool that then pulls all of the available plans in the market, and then we look for the one that gives you the least cost for your least annual out-of-pocket expense, and then still gives you good coverage. So hopefully I haven't lost you yet. Are you bored to tears? I know that this is crazy dry and you probably don't want to watch this anymore, but stay tuned. We're almost done. Another choice for your secondary coverage is the Medicare Advantage, also known as Part C. On the worksheet on your screen, these are the plans you typically see advertised on TV, and celebrities such as Joe Namath usually do it. These plans are different than a Medicare supplement in that you assign your original Medicare over to a private insurance company that may be United Healthcare, Humana, Aetna. There are several out there who offer Advantage plans. They take over management of your care. And remember, in this scenario, you still have to keep your foundation to your house in place, so you will continue to pay for your Part B coverage to Social Security. But in a Medicare Advantage, it's different than a supplement because doctors will then bill the insurance company instead of Medicare. So in this case, you would put your Medicare A and B card away in a safe place at home. You would get one ID card issued from the insurance company. That often includes your prescription drug benefits. Most of them include prescription drug benefits. And that's the only ID that then you would carry with you. The types of coverage that you see most often with Medicare Advantage plans are HMOs and PPOs. They're offered by, again, private insurance companies. And I'm going to repeat it again. They often include prescription drug benefits. These plans are often 0 to low monthly premium, and they often have very low out of pocket. In these plans, you're going to make copays when you use the plan. So sometimes you're going to get plans with a zero copay for doctors, surgeries, hospital stays, and they're very affordable. In HMO, it stands for Health Maintenance Organization. It's a closed network of contracted providers, which means if you go out of the network, then you are paying 100% out of pocket to see non-contracted doctors. In this scenario, you typically choose a primary care doctor who then refers you to see specialists. These plans have overall the lowest out-of-pocket max limit expense. So if you're on a tight budget, an HMO is a good way to go. A PPO stands for a preferred provider organization, which means there's a contracted group of doctors, but you have the ability to go out of the network for a higher cost share. And these offer access to their national network of providers. So you could even go visit a doctor in another state as long as he's contracted with that plan and the Medicare Advantage plan, then you would pay the in-network copay. So it's a good way to still have flexibility to see any doctor who accepts Medicare and give you some extra benefits that come along with Medicare Advantage plans. Medicare Advantage plans are very attractive to so many because they do provide those additional benefits that are not covered by Medicare, such as routine dental, vision, hearing, 24-hour nurses hotline or telemedicine, a dollar amount for over-the-counter products. For example, toothpaste, deodorant, that kind of thing, over-the-counter products that you would buy in a drugstore. And you would see benefits for private transportation to and from medical appointments, fitness classes, gym memberships. And then in 2023, they're going to enhance that by giving you Visas and MasterCards loaded with money so that you don't have to order from a catalog. You could just walk into the retail store and buy your products there. And some cases are even going to give you enough money to pay for your groceries, help you pay for groceries, utilities, pay your rent. And there's some plans even have help for caregivers and a companion robot. Crazy stuff, right? I hope I provided you with at least a path to follow when you're making your choices. I provide personally a no-cost service to my clients. It's an unbiased service, and I help them select the plan options that's going to work best for them and their needs. And doing that, we just get a list of your doctors, your medications, and we talk about your budget. And then as brokers, we are trained on and learn the differences between the insurance carriers so we can help steer you to the one that's going to fit your needs best, and you don't have to pay us because the insurance company pays us a commission to provide the service to you. So again, I've been doing this since 2004. Give me a try. If you need my help, call me. You can reach me there's a description. In the description, you're going to find my email and phone number. Just call me or send me an email and we'll set up an appointment, and I can either do virtual or if you're local, visit you face to face. Anyway, thank you for your attention. If you found this video helpful, please hit the like button. I love giving you this information, so please also give me some feedback if I can help you with some questions that I haven't answered. And please share this with whomever else you think might need help. Thank you.